The Dignity and Respect campaign was founded at UPMC in an effort to create a workplace where employees, patients and their families, health plan members are treated with dignity and respect. What started at UPMC has become a national initiative focused on making the world a better place for all to live with all of our differences, with a shared mission to inspire behavioral change by promoting dignity and respect in organizations, communities, and schools, enabling improved employee engagement, customer service, retention of employees and customers, and the community experience, as well as reducing bullying in schools. At UPMC, dignity and respect has become a part of everything we do, serving as the foundation for the UPMC experience, which focuses on 4 areas: employee, patient, health plan, and the community experience. It is everyone's responsibility, and it is not limited to our employees. It extends to patients and their families, health plan members, customers, business partners, and the communities we serve.
Our mission is to serve our community by providing outstanding patient care and to shape tomorrow's health system through clinical and technological innovation, research, and education. And I'll say a couple quick things. This mission has not changed. I've been at UPMC for 26 years, but this has been what has existed over the 30 years that is what is now UPMC as our mission. And it's very different than the mission of many of the other local healthcare entities. And that's what makes our mission, I think, very unique and very important, not just to this region, but very important to the country. Advances in medicine and that next generation of healthcare professionals are being developed here locally, all within the walls of what we do every day. We did change our vision to the words that are colored here. We decided to make sure it was very clear. It's not just, it used to say just putting our patients first. But obviously, we have health plan members, over 2 million of those. We have employees in our community. And we really wanted to be very, very clear that our vision was not just serving our patients, but serving everybody that UPMC serves. We recently communicated our new values. We had good values before. These are good values now. We really wanted to simplify them. We really wanted to simplify them to things that we could all understand and believe in and recognize these are what we at UPMC value. Now, I will tell you, these are just words. The key is us as an organization living those out, and that's all of us. We have to live these values out every single day with each other and with our patients, members, and with the community.
We're all in this together. We're all in this together. We're all in this together.
Our dignity and respect journey began by asking employees during focus groups what happens in an environment where people are treated with dignity and respect. The result? 30 tips of dignity and respect, which are behaviors we all know how to exhibit, but can do more consistently for all people in all interactions. We also spent time with UPMC employees across the system, sharing the feedback from the focus groups. We've integrated these concepts into our work processes, learning programs, and we've created Dignity and Respect Month to celebrate organizational best practices and to recognize employees both internally and externally for being champions of dignity and respect. At UPMC, we're moving from bolted-on efforts to promote dignity and respect to built-in practices that create sustainable progress and accountability. I think it's really important for us to let employees know that this isn't Tammy and Mary Beth and Will and Candy, and it isn't just corporate and HR and the health plan and one hospital. It is all of us doing this together.
Dragon meetings are happening now. On the heels of that are going to be the road shows that we talked about earlier, and that's going to all happen the remainder part of this calendar year. January, Dignity and Respect Month, where we'll probably actually get out to everybody these materials that we're talking about now. so that then we're leading up to March of employee appreciation. And so, this group will evolve, and the next thing that we do is going to evolve. It took a while to get us going, but now we're launching, and then we're going to take off.
So we'll get the values out there first, because that was your decision that we do that first. And then right behind it, we're going to just send out the same things about leadership rounding and tips and those tools that Eric and others had put together. Because now they have context. While many of you have done rounding, not everyone has done rounding, as Candy mentioned. For some of our corporate BUs, last year was the first time they ever did it. There's no greater way to get that engagement than to see the leaders doing it, and then now we're asking you to do it if you haven't. So I think the sequencing is very powerful right now.
The only way we're going to really change the culture is if we begin to grab it and do these sorts of things. And so this, we're all in it together, I think is spot on.
I joined the Center of Inclusion last week. It's exciting. Hearing David every minute say we are all in this together. I think it's amazing. Because I think one of the things that I have seen during the course of my 1 week here is not only we trying to get the associates or employees to know that we are all in this together, but it is very important. It's what is unique about us. What we want to do is, we are all UPMC, but we don't want you to change who you are.
To measure our progress, we've created the Dignity and Respect Index, which gives us an indication of how employees are feeling and if they're treated with dignity and respect by their peers, their supervisor, and senior management. We also want to ensure that we have embraced the culture of dignity and respect. Sometimes it's the smallest things that have the biggest impact. By practicing one of the 30 tips each day, each of us can make UPMC a better place for all to work with all of our differences. The 30 tips serve as the foundation for the initiative. Tip number 11, treat others the way they want to be treated. Many of us are familiar with the golden rule. Treat others the way you want to be treated, which is the foundation for respect. Cultural competency and awareness, however, is about treating others the way they want to be treated. It is the platinum rule.
My name is John Silipini. I'm the Director of Care Management at McGee Women's Hospital. I've been a UPMC employee for the past 31 years. We had received a phone call at McGee related to a woman who was about to give birth in the next several weeks and was interested in what kind of equipment we had available so that she would be alerted to any time her baby would be crying in the room. So at that point, we partnered with the Pittsburgh Hearing and Deaf Services to see what kind of equipment was available for her and learned that there was a device called the Baby Cry Alert that we could purchase and have available for her when she did deliver.
My name is Becky Riddle. I've been with UPMC for 39 years. I'm a postpartum nurse at McGee Women's Hospital. Here at McGee, we provide for our deaf patients a baby cry alert, which alerts the mother when the baby's crying. We insert a paddle under the mother's pillow so that when the baby cries, it vibrates and the mother knows that the baby's crying. We also provide a doorbell at the door because they can't hear a person knocking, and it alerts to a strobe light that comes on so that they know that somebody's going to be walking into the room.
In addition to that, we provide translators for our deaf population for American Sign Language when that's necessary also. Since this first situation, we've used this equipment on multiple patients who come to deliver here at McGee on our postpartum unit so that they can be alerted to when their babies are crying.
This was the first experience I had with the Baby Cry Alert. It has changed how I will probably approach a patient that is in need of this, because in the years past, this was never available to us. So it gives us the opportunity to really be able to take care of this patient and her baby much, much better.
It certainly improves the care experience here at McGee. It also allows those new parents to understand what equipment is available and what they might be able to obtain for when they do go home with a newborn.
Tip number 12, be culturally competent. We want to ensure that our employees have cultural competency tools to help treat others the way they want to be treated. CRIS represents the various considerations that could influence the healthcare experience and day-to-day interactions with others. CRIS is our cultural competency model. CRIS offers cultural competency tools to support 3 levels of interaction. Level 1, foundational, for occasional day-to-day interactions. Level 2, intermediate, for frequent cultural interactions. And Level 3 is advanced, cultural immersion. Mapping our resources is an important component of the CRIS Cultural Competency Initiative, and ensuring that we have tools for each level of interaction, ranging from dignity and respect for occasional interactions to the CRIS videos and Interfaith Pocket Guide for frequent interactions, as well as ensuring that we have relationships with community partners and best practice sharing at a CRIS conference that enables us to learn from others.
My name is Fernando Holguín, and I'm an associate professor of medicine and pediatrics, and I'm the assistant director of the Asthma Institute at UPMC and the School of Medicine. The ICU environment is a complex environment. It has a lot of movement, a lot of whistles and alarms constantly sounding. I think it's a stressful environment for patients and for their families. So for someone in that environment who doesn't know the language or comes from another country or has different cultural background, the environment could be even so much more stressful because they don't understand what the nurses are talking about, what the doctors are saying. You know, a common way to open a conversation is to ask what are their expectations. So I think asking relevant questions about beliefs, expectations, gives you an of where people are and how you need to proceed and move forward. If you have a family and they feel comfortable talking to you, they will be more likely to open and share fears and expectations. And then when you make a decision, you'll be able to do it in conjunction with them and what's the best decision for the family member and for them. One example of where you need to have cultural sensitivity is the one that you're mentioning about regarding a young Muslim patient that had come from another country. This patient was fairly ill and was not conscious, but a lot of the communications happened with their family. And it so happened that he had a large beer that needed to be treated with a topical medication. And of course, the treatment of choice would have been to shave the beer. But we couldn't do that, and we learned that through communicating with the family on multiple instances that the beer has a profound meaning in their culture. So if we had done that, it would have made the family felt not understood and not well received. And so I think it would have complicated things in a much greater way. So we worked with them and we treated it multiple times as best as we could without shaving the beer.
Dignity and Respect tip number 28, take a healthy step, is supported by initiatives in the workplace, including applications such as My UPMC, My Health, and in the community, supported by initiatives such as the Community Health Needs Assessment and a number of initiatives that fall under what we call Healthy Community, Healthy You. Dignity and Respect tip number 29, Lend a Hand, is supported by initiatives such as donation drives, school supplies, pet food and toiletry items, 2 volunteer days of service, including churches, Latino Family Center, MLK Day, and Pittsburgh Pride. And of course, it is important to recognize those who support the initiative and are leading the way. Tip number 30, be a champion. Internal recognition that can be supported by online e-cards for peer-to-peer, an annual recognition event of Dignity and Respect champions at UPMC, has now become a community recognition, where each month we recognize community champions in Greater Pittsburgh, as well as host an annual community event to recognize community leaders annually each Dignity and Respect month.
UPMC recognizes that a strong community takes the support of many. We're proud to work with over 350 organizations and schools who serve those in need and ensure that all our patients, employees, and community members are cared for in the best way possible. We live here, our children attend school here, our parents are retiring here, and while our motivations to get involved may be different, for many it's an opportunity to give back, for some it's an opportunity to get involved, and yet for others it's deeply personal. We are all doing our part to make our region a great place for us to live, work, learn, and enjoy life with all our differences. Whether it's through the dozens of donation drives, workforce development programs, numerous youth activities, or the many help through UPMC's patient care services, we are making a difference together. Today, we celebrate all of you. UPMC couldn't make a significant impact if it didn't team up with so many creative and passionate people at local community organizations and within UPMC. We look forward to continue working with you to improve the overall health of our communities. We are all in this together.
We're all in this together! We're all in this together! We're all in this together! We're all in this together!
What began as a workplace initiative to promote a culture of inclusion, engagement, dignity, and respect at UPMC has become an inspiration across the nation. Supported by Dignity and Respect Solutions for Organizations, for which we have many partners. Dignity and Respect in communities such as Pittsburgh and Multnomah County. And Dignity and Respect for Youth, which is today in 33 school districts across the U.S. You too can be a champion, because together we can make the world a better place for all to live with all of our differences. We are all in this together.